Hey, this is Ray Hilbert, and I am really excited to have a conversation today with my newfound friend over the last few months. It's been awesome to get to know Dr. D. Bonney, and we're going to talk about a topic today, and we're recording this because there's no secret here that healthcare costs are out of control. It's getting increasingly difficult to get good medical coverage and to find the types of providers that bring you and your family what they need and at a reasonable cost. And so we're just going to take a few minutes. We're going to share with you about Dr. D and his program. There's some really unique factors here, some really unique elements in the way this model works. And so you might want to grab a pen and a notepad and take a few notes. But D, and let's have a conversation. Let's help these folks understand what you're doing. And you've got a new model of delivering healthcare. Why don't you tell us about the name of your company and about this model and a little bit about your background and why you decided to do this?
Sure. Thanks, Ray. I appreciate that. So our office is called Alpha Omega Elevation and Wellness. We are a faith-based medical practice. And so really, what I've realized is I feel like most people have kind of given up on being overly prepared ahead of time for a healthcare issue. Because let's face it, healthcare in this country is a mess. It's neither affordable nor convenient. And so what we're doing is we're trying to solve both of those issues for people. We're bridging that gap between what people have available to them in not just access from a financial standpoint, but just access to be able to get a hold of their doctor in real time. So we're trying to fix both of those problems. So what we're doing is we're doing a model called direct patient care. And what that means, it's a membership model, just like joining the gym. Basically, you pay a monthly membership fee. Our prices, I think, are really just affordable for people. So $69 a month for the first adult in a family, and then $25 for spouse or dependent children. We even kept that at $3. So we don't charge more than $25 times 3. So if you have a big family like I do, several kids end up being free. But the idea is that you pay a membership model, and then whatever you need in the realm of primary care or urgent care, you just come see us when you need us and we take care of it. And there's no copay, no extra fee. For anything that we can do in the office in those two areas, you're just covered. So I think it helps people to kind of have this line item in their budget where they know, okay, I pay my auto insurance once a month. Hopefully they pay their life insurance once a month, and I pay my membership to Alpha Omega Elevation and Wellness. And then there really aren't surprises when it comes to most of the regular, more common issues that we face in our healthcare needs. So whether that's like you need just an annual physical to make sure that you're okay, your kid needs a sports physical, you slice your arm open cutting onions and you need sutures, you get sick with nausea, vomiting, diarrhea, you need some IV fluids and some IV medicine. All of that's just covered when you come see us. We'll splint injuries. We even have IV medication to stop migraines, just like we stock in the emergency department. My background is I've been an emergency physician for 20 years. And during that time, I've seen the evolution of healthcare and how basically we have all of these other entities triangulating the relationship between doctor and patient. And what this model does is it kind of eliminates those triangles. So basically it's you and me in a relationship together trying to promote your wellness and then take care of any urgent and sick needs that happen along the way.
That's fantastic. And I'm sure before we end our conversation, I'd like to share my own experience with you and your team, which has been fantastic. And actually, that's kind of what led to us wanting to do this conversation, is just helping to get this word out, because it is so frustrating, as you've talked about, just the big healthcare networks. Getting in to see your doctor is one thing. Getting tests or getting into specialists is a whole other not only is it extraordinarily expensive, but it's just monumentally complex. It's just not convenient. And so I know that's what your model is designed to address. So how does this help, businesses afford healthcare benefit to the employees in this day and age of extraordinarily rising costs? How does this help businesses manage healthcare costs?
Yeah, so I think, you already touched on it. I mean, health insurance, traditional health insurance is just it's insanely expensive. I mean, when I was still working full-time as an emergency physician up until the end of 2020 and having my own health insurance, I know that for our family, we were paying $18,000 a year so that we could then spend the first $2,500 per person or $7,500 for the family out of pocket. And you're like, that's just insane. And so when employers are trying to provide a healthcare benefit, normally they just see that one option. Like we either offer traditional health insurance at a cost of, depending on how you're splitting it with your employees, $400, $800, $1,000 to the employer per month. And for small to medium-sized businesses, that's just untenable. So they either see that option, or the other option is like, we just don't offer a health insurance benefit. Like
Yeah.
if it's a smaller business under 50 full-time employees, the equivalent thereof, I think, you're not required to offer this. So a lot of these smaller businesses, they simply can't. And so what we offer is the ability to provide a healthcare benefit that's not insurance, but it's something. And so it gives your employees access to care. So that $69 a month, honestly, when we start doing corporate discounts because you're enrolling 15, 20, 30 employees. So if we get that number, that dollar amount per employee down to $50 a month, I mean, man, especially if an employer splits that cost with an employee, we're talking about $25 for the employer, $25 for the employee. That's Happy Meal money.
Yeah.
We can provide a benefit that covers some healthcare needs. Because typically, if you don't offer insurance, you're not covering anything. And so I think what this does is it helps employers retain employees, because the next shiny thing that comes along, especially if that next shiny thing offers some health insurance, they're not going to necessarily need to go to that. And it helps to recruit good employees.
Yeah.
I mean, I think what employers have going for them is like, health insurance is expensive, even if a company is covering part of it. So, they might risk losing an employee to a place that offers health insurance, but that health insurance might cost the employee $200 to $400 per paycheck. So even that, for a lot of people, is just too much money. So even though in the companies where health insurance is offered, not everybody takes it because people can't afford to spend the extra $600 a month. And so the other thing I think that plagues employers is just employees not being well. And so if I have a high deductible insurance plan, even if I have insurance and I'm sick, now I have to decide, okay, I essentially don't have insurance until I meet my deductible.
Right.
So I'm getting out of pocket until I've spent $2,500 or more. And so now I'm in a position, if I don't have this membership model, where I have to decide, okay, is it worth spending the $300 to go to the urgent care? Is it worth spending the $900 to go to the emergency department to be evaluated? Well, with this model, the employees know, yeah, it might take me a little bit of time to just go to the office and get seen, but at least I'm going to get seen and I'm not going to have any extra money out of pocket. So I think when you think about those costs to a business that illness brings that aren't really a dollar amount, but just employee productivity, or the employee that does have to go to the ER and has a $1,200 bill, and now they're getting calls at work from the credit agency to try to collect that money. All of that actually makes our businesses function less efficiently. And so I think having this model that we can offer to the employees is going to really help businesses in just the tangible way of recruiting and retaining employees, but also that less tangible idea of just having employees that are well and aren't as concerned about their health.
That's great. So I think that does a great job of helping us to understand the value to the employer and to the employee from a financial standpoint. But you mentioned earlier about the importance of convenient access to the physician and how your model addresses this. So would you elaborate on that just a little bit more, the importance of that and the value of just the convenience factor?
This is the part that I really love. You see, when you have a primary care office and you are seeing patients with the insurance-based or fee-for-service model, your schedule's tight, right? Like you have to pack patients in to make any money to earn a living. With this model, as soon as people enroll in our program online, the very first welcome email that they get the doctor's cell phone number. So to me, that is, you already know that you're connected. So if you have a healthcare issue come up, You're not calling our office and wading through some complicated phone tree, leaving a message, hoping that we get back with you today or tomorrow. And then honestly, like in a lot of practices, sometimes like a medical assistant might kind of intercept the message, and like they know what the doctor tends to say in the situation. So the answer you're getting may or may not be from your doctor. But with this, I know that my patients can just text me. We can have a conversation. And I think they feel that relief of knowing like, okay, if anything comes up, I know I got a doctor on speed dial. I got a doctor in my back pocket. And so for them, for the patients, it's peace of mind. For me, it's just nice to be able to be relational with people and to know where they are. I can text them and follow up and be like, hey, how's your ear infection doing? And it changes the entire dynamic. And you don't really have that luxury when you're, seeing patients in 8, 12, 15-minute increments.
Yeah.
And the patient's trying to pack 40 minutes worth of concerns into a 12-minute visit, so we have more time to spend with our patients when they come in because we aren't, packing them in like sardines. So I think the patients feel better heard and understood. Their issues are addressed, which kind of preemptively helps head off issues down the road where it's like, well, I kind of went over this with my doctor and he kind of glanced over it and didn't really address it. I hear that all the time in the emergency department. And I get it. Like, you've got to kind of stay on schedule. And I think just that accessibility is really, it does promote health. It promotes the relational qualities that we're trying to develop with our patients. So
I'd like to actually speak to that from a personal experience in that shortly after signing up for the service, I one morning, as you well know, I had a medical issue arise, and it was shortly before 7 a.m. I texted you and I said, hey, D, here's what's going on. And within 90 minutes, I was with one of your associate doctors, saw this doctor face to face, and immediately got some tests, got some things, some evaluations done that I needed to get done. And I can tell you, without giving the dollar amount, it was probably about 20% what I expected it was going to cost me to get those tests ran. But the convenience factor and the excellence was that within 90 minutes of you and I having an initial text conversation, you had me in front of one of your associates. I was live in front of the doctor, getting thoroughly examined, getting the tests I needed. And by 1 p.m. that afternoon, I had at least answers on what I wasn't dealing with. And that's just unheard of. And I often tell people, D, about the only thing I run well is my mouth. And I've told everybody I know about that. And so it's just what you've talked about, both the convenience, but the cost savings were terrific. So I've shared a little bit of my story with that, but who are the people who will most benefit from this model?
So I really see, so businesses for sure, we've already kind of talked about, but I kind of see 3 different groups or subgroups of people that this really helps. First of all, the people who have no insurance, right? And I'm always going to recommend when I see somebody and they have no insurance, I still recommend that they get some sort of catastrophic plan so that, when something happens, there are things that are going to happen that we can't take care of in our office. I'm not taking your appendix out in my office, right? And so those things that will happen, people still need to have some sort of coverage. But I tell you, if somebody has no insurance and they have our plan, we can still save them thousands of dollars because we know how to navigate that healthcare maze. Like we just know how to get things done efficiently. I mean, a good example is my mother-in-law had appendicitis the end of 2020. And I was actually her doctor in the emergency department, but she shared her bills with me. And so in the hospital, she had a $3,200 CT scan. I can get that on an urgent basis as an outpatient for $500. She had a $3,800 ER bill. Now you're like, why did you make your mother-in-law go through the emergency department? Our program didn't roll out like this until January. And so what happens is if I were to see her in our office and I knew that she had no insurance or had a really high deductible, I could get a stat or an urgent outpatient CT scan on her. I could save her a visit to the emergency department, even if we knew if we found out that she had appendicitis, I could call up one of the local surgeons and say, hey, I've got a patient who they don't have insurance. They don't want a really high bill. They don't want to come through the emergency department if they don't have to. Can you see them in outpatient surgery and take care of this? And so looking over my mother-in-law's bills, I'm like, oh, well, $6,500 would have come off of that bill if we had funneled her through our office, as an example. And so I think, so first of all, people who don't have insurance. Secondly, most everybody else who has high deductible plans, they benefit because, let's face it, your chances of needing IV fluids or a laceration sutured is higher than your chances of needing your gallbladder out or appendix out this year. Like, common things are common. And so all those common things we can manage, and even the things that are a little bit beyond the scope of what we can do, we can still help minimize those extra costs by just efficiently going through the system, right?
Yeah.
I think the third person that this benefits is the person who's just like, well, the deductible is not an issue and I do have insurance, but I just want to have time face to face with my doctor. I don't want to take 40 minutes worth of complaints and try to put it into a 12-minute visit. So I think just that accessibility, I say that we're not providing health insurance, we're providing health assurance, right? So just that connectivity has value to people. I've told people, I'm like, you could literally have our service, you could join our program and not need us the entire year. I think it still had value. It's just like when you send in your auto insurance payment, you don't get upset you didn't have a wreck last month, right? It's there for when you need it. You know that when you do have to engage the healthcare system, you got a doctor who's going to walk with you through that. And so I think those are kind of the three people that benefit most from this model.
Oh, that's fantastic. So we've talked about, and we'll wrap up here real shortly here, but we've talked about the model, why you started it. We've talked about how it helps businesses and employees, both financially and with productivity. We've talked about the convenience factor. We've talked about who most benefits from this. So the last question I wanted to ask you is, it's really just more of you've been talking about promoting healthcare, personalized healthcare, and why and how are you more personalized than that traditional office? And we've touched on it, but there's probably a little bit more we need to know about.
Yeah, I think I have a heart for connecting with people. I'm 3 credits shy, full disclosure, of having my master's in pastoral counseling and marriage and family. But when people come see me, I try to find opportunities to connect if the opportunity's there. I mean, as an example, we had a patient come see us and she had suffered the loss of a spouse about 2.5 years ago. And I wasn't even seeing her for that, right? But having that time, that connectivity, that rapport, we kind of got into talking about that. And it was clear to me that she really hadn't moved through that grief. She was still carrying around just this heavy weight of what she had experienced. And so just being able to have that relational connection with people, I was able to point her to a good female Christian counselor so that she could really start healing a little bit better from the trauma that she had experienced. And so I think it's that. I think it is that connectivity. It's that knowing that I'm going to text my doctor and he's going to get back in touch with me. We don't claim to be available 24/7 to people. I can't do that. But if you text me during, business hours, daylight hours, you're probably going to get a text back pretty fast unless I'm in with a client or doing some relationship coaching. And so I think that's kind of what sets us apart. And again, if we were trying to pack people in so tightly, we wouldn't be able to do that. And so I really believe this model is really the future of healthcare. I mean, I didn't invent it. There are other places around that do that. We're just trying to do it in a very robust fashion. I mean, with my experience in the emergency department, I make sure that if there's anything that we can do in our office to keep you from having to spend, I think the average ER bill is $1,400. To keep you from having to spend $1,400 on something that we can do in the office, like, I'm going to do that. So we make sure that we have what we need to be able to provide urgent services to try to help people just not blow through their $2,500 deductible over an illness. I mean, I got sick a couple years ago and I thought I just had a copay to go to the emergency department. No, I had a $2,200 bill when I left. I'm like, oh, like, I earned a decent income, but that's still $2,200, man. That's right.
That's right. Well, that's right. It is about that personal touch and knowing what's going on in their lives, and sometimes what's caused the problem, not just that they have a problem, but how do we get there, right? And so this has been great. It's been very helpful. So if someone's listening to this conversation and they're interested in getting more information or what they need to learn, what's the best way for them to reach you?
So if you just want to email me directly, my email is dbonney@gmail.com. So that's DEEBONNEY@gmail.com. I'm terrible at unplugging, so I'm pretty compulsive about answering to me, unfortunately, sometimes. Our website is alphaomegaelevation.com. And so you can go in there and kind of explore, everything that we have to offer. And yeah, we're just ready to show up and serve people as they need. And if we have a conversation and this ends up not being a good fit for you, I'm cool with that too. I just want people to understand that there are other options out there other than just, I have traditional insurance. I go to, a primary care doctor once a year when I need it. And then when I get sick and something emergent happens, I have to go to the ER. A lot of primary care offices, they can't even give you IV fluids in the office. Like, they're just not allowed to do that. It's probably too inefficient. And so we're showing up different for people, and I love it.
That's fantastic. So that was dbonney@gmail.com and alphaomegaelevation.com. That's how you can check it out, folks, and get with Dr. D. D, thanks so much. We're going to get the word out, folks. This is good stuff. I hope that you'll take a look at it for you and your family. And for business owners, it's ideal as a benefit for your employees and for your company to help both financially, but also in terms of just efficiencies and effectiveness in your business. So God bless everybody. Thanks for joining us.